Welcome back to the channel. Today we're diving deep into a topic that affects millions of families and cuts right to the heart of healthcare differences. How do maternity care and costs compare between the United States and the United Kingdom? Whether you're planning to start a family or just curious about how two wealthy countries approach pregnancy, childbirth, and postpartum care, this video will give you a comprehensive breakdown. We're going to look at everything from prenatal care, hospital birth experiences, postpartum support, and parental leave, to the actual cost of having a baby in both countries. 1. The big picture, two very different systems. United States. Maternity care in the U.S. is delivered almost entirely through the private healthcare system. Insurance coverage or lack thereof plays a huge role in determining access and affordability. Women rely on obstetricians as the primary maternity care providers. United Kingdom. Maternity care is provided through the NHS and is free at the point of use for everyone, including non-citizens in many cases. Care is midwife-led for most women, with obstetricians involved when complications arise. Right from the start, the financial structure and care model are fundamentally different. 2. Prenatal care. United States. Standard prenatal care includes about 12 to 14 visits over a typical pregnancy. Most women see obstetricians, OB/GYNs, for routine care, with some choosing midwives. Ultrasounds and tests vary but are common and often billed separately. Costs. Without insurance, prenatal care alone can cost $2,000 or $5,000 plus. With insurance typically subject to deductibles and copays, many women pay $500 to $2,000 per out of pocket just for prenatal care. United Kingdom. Prenatal care is free through the NHS. Women have an initial booking appointment with a midwife around 8 to 10 weeks, followed by a schedule of visits. 10 appointments for first-time mothers, 7 for subsequent pregnancies. Routine ultrasounds at 12 and 20 weeks, no charge. Additional care provided as needed, all included. In the UK, prenatal care costs $0 at the point of use unless opting for private care. 3. Birth and delivery. United States. Hospitals dominate childbirth. About 98% of births occur in hospital settings. Choice of provider and hospital often dictated by insurance network. Medicalized approach, high rates of interventions, e.g. epidurals, inductions, C-sections. Costs. Average hospital birth without complications, $12,000 to $15,000 before insurance discounts. Cesarean birth, around $18,000 and $25,000 plus. Even insured women face substantial out-of-pocket bills. Typical range, $2,500 to $5,000 or more depending on plan. United Kingdom. 99% of births occur under NHS care hospital or midwife-led units. Options include consultant-led labor ward, midwife-led birthing center. Home birth, supported by NHS if low risk. Lower rates of intervention, fewer inductions, epidurals, and C-sections compared to U.S. averages. Costs, free at the point of use, $0 for all hospital, birthing center, or home births under the NHS. Theater, postpartum care, United States. Typically one follow-up visit around 6 weeks postpartum. Postnatal support depends on insurance and personal resources. Limited home visits. Breastfeeding support may or may not be covered. No national standard for maternal mental health support. United Kingdom. Routine postnatal care provided by midwives during the first 10 days after birth, home visits or clinic visits. Health visitors continue care for up to 1 year, focusing on maternal and infant well-being. Free breastfeeding support and referrals for maternal mental health when needed. UK families receive far more structured and integrated postnatal care, all included at no cost. 5. Parental leave policies. United States, no federal paid maternity leave mandate. The Family and Medical Leave Act, FMLA, guarantees up to 12 weeks of unpaid leave for eligible employees, but many workers do not qualify. Some employers offer paid maternity leave, but this is employer-dependent. Result: many American mothers return to work quickly because they can't afford unpaid time off. United Kingdom. Statutory maternity leave. Up to 52 weeks, 26 weeks ordinary, plus 26 weeks additional. Statutory maternity pay for up to 39 weeks. 90% of average earnings for the first 6 weeks. Then $172 2025 rate. Or 90% of average weekly earnings, whichever is lower, for the next 33 weeks. Shared parental leave allows partners to share the leave and pay entitlements. The UK system provides far more generous and universal maternity and parental leave than the US system. 6. Maternal mortality and health outcomes. United States. Maternal mortality rate, around 17 deaths per 100,000 live births, among the highest in developed countries. Higher rates among women of color and disadvantaged communities. Greater rates of medical interventions. United Kingdom. Maternal mortality rate, around 7 deaths per 100,000 live births, less than half the U.S. rate. Outcomes are more consistent across income levels and racial groups. These differences reflect broader healthcare access and quality issues that directly affect maternity care. 7. Average total cost to family. Let's summarize average maternity costs to families. United States. Total out-of-pocket costs for a typical insured woman, prenatal plus birth plus postpartum, 3,000, 80,000 plus, depending on insurance plan and location. Without insurance, 15,000, 30,000 plus is total. United Kingdom, $0 for all standard maternity care under the NHS. Optional costs, private maternity care, rare. $5,000, $10,000 for prenatal plus delivery. 8. Cultural attitudes toward maternity care. U.S. Maternity care is highly medicalized, choice-driven for those with good insurance. But fragmented care quality can vary dramatically depending on coverage. UK. Maternity care is integrated, midwife-led, with a strong focus on normalizing pregnancy and birth, reducing unnecessary interventions, and ensuring broad access. 9. Role of midwives versus obstetricians. United Kingdom. The UK maternity care system is midwife-led by default. Midwives are the primary care providers throughout pregnancy and labor for low-risk pregnancies. Women typically see the same team of midwives from antenatal care through delivery and postnatal follow-up. Obstetricians are consulted if complications arise or if a pregnancy becomes high risk. This continuity of care from a small team of providers fosters trust, familiarity, and holistic support, a core feature of NHS maternity services. United States. The U.S. maternity system is obstetrician-led by default. Even for low-risk pregnancies, most women receive care from OB/GYNs. Midwives play a smaller role, largely concentrated in birth centers or home birth settings. Fragmented care. Women may see multiple providers throughout pregnancy and delivery depending on insurance, practice size, or hospital policy. The medicalized, specialist-driven model in the U.S. emphasizes risk management, but it can feel less personal and more procedural for many women. 10. Home birth and birth center options. UK. Home birth is supported and funded by the NHS for low-risk pregnancies. Midwives attend home births and provide postnatal care. Birth centers are common and viewed as a mainstream option. US. Home births account for a very small percentage of all deliveries, about 1 to 2%. Insurance coverage for home birth varies and is often excluded or requires out-of-network payment. Freestanding birth centers exist but are not as integrated into the mainstream system as in the UK. UK families enjoy greater institutional support for home and birth center options, while US families face more barriers, financial, legal, and cultural, when choosing alternatives to hospital birth. 11. Cesarean section rates. United States. C-section rate around 32% of births in 2025, among the highest in the developed world. United Kingdom. C-section rate around 27% of births in 2025, lower but rising. Cultural and medical practice differences contribute. U.S. system emphasizes physician-led defensive medicine. UK midwife-led care tends to promote natural labor and reduce unnecessary interventions unless clinically indicated. 12. Pain management options. UK. Epidurals are available but less frequently used than in the U.S. Midwife-led units emphasize natural birth with alternatives like gas and air nitrous oxide, warm water immersion, massage and mobility during labor. Women can still access epidurals in consultant-led hospital units, but there's a stronger cultural emphasis on physiological birth. U.S. Epidurals are used in about 70% plus of hospital births. Wider use of continuous fetal monitoring and interventions that increase epidural rates. Pain relief in the U.S. is more medicalized, with epidural analgesia as the norm in many settings. 13. Postnatal mental health care. UK. The NHS integrates perinatal mental health screening and support into routine care. Health visitors continue home visits to monitor maternal mental health. Specialist perinatal mental health teams available for moderate to severe cases. U.S. Postpartum depression screening is recommended, but coverage varies depending on insurance and provider. Access to specialist mental health services depends on insurance coverage and location. UK mothers generally have more consistent access to publicly funded mental health support in the postpartum period. 14. Role of community support. UK. Health visitors play a significant role. Government-funded professionals who provide home visits from around 10 days postpartum to toddlerhood. Support includes maternal health checks, infant development checks, feeding support, and parenting advice. U.S. No equivalent national program. Postnatal support often relies on private lactation consultants, out-of-pocket or insurance-dependent. Paid postpartum doulas, entirely private market. Online resources or informal community groups. UK families have more integrated and accessible postnatal community care built into the healthcare system. 15. Financial risk and impact on families. U.S. families. Maternity care costs can be a major financial burden even for insured families. Surprise billing is still a concern. Out-of-network anesthesiologists, pediatricians attending birth, etc. Women without insurance face catastrophic costs that can discourage seeking care altogether. UK families? No direct financial burden from maternity care. No worry about in-network providers, billing, or negotiating costs. Focus remains on health, recovery, and infant care rather than managing bills. The financial impact of having a child is much greater in the US than in the UK, with real consequences for family well-being, mental health, and economic stability. 16. Maternity care for vulnerable populations. US, major disparities in maternal outcomes. Black women are 2 to 3 times more likely to die from pregnancy-related causes than white women. Access to prenatal and postpartum care varies widely by income, insurance status, and geography. UK, disparities exist but are smaller due to universal healthcare access and more standardized care pathways. Both countries face challenges, but the NHS framework reduces some structural barriers that worsen outcomes in vulnerable U.S. populations. Summary. Let's bring this all together. Prenatal care free under NHS versus costly and insurance-dependent in the U.S. Hospital birth. Zero out-of-pocket under NHS versus $2,000 to $5,000 plus for insured U.S. women. $15,000, $30,000 plus for uninsured. Postpartum care. Extensive midwife and health visitor support in UK. Minimal fragmented care in the US unless privately paid. Maternal health outcomes. UK has lower maternal mortality and fewer disparities. Parental leave. Statutory paid leave in UK, no federal paid leave mandate in US. Financial burden. Maternity costs can cause significant financial strain for US families. Almost none for UK families using the NHS. The maternity care experience reflects wider differences in healthcare systems. A publicly funded, universally accessible approach in the UK versus a market-driven, insurance-dependent approach in the US with profound implications for maternal health, infant health, family finances, and social equity. That's it for this fully extended deep dive into maternity care and costs in the US versus the UK. If you found this helpful, subscribe and turn on notifications. We've got more thoughtful comparisons coming soon on everything from healthcare and education to taxes, business loans, and life expectancy. And as always, I want to hear from you. Have you experienced maternity care in either country? Which system do you think better supports women and families? What changes would you like to see? Drop your thoughts in the comments. Let's discuss.